Hey everybody, my name is Travis Robbins.
And I'm Todd Robbins.
And we own Robbins Rehabilitation, a physical therapy company here in the Lehigh Valley. And today we're here to go through a 3-exercise program that you can do at home for general back health. Okay, so it's not very specific. We see a ton of spine in our clinics, and every patient that comes in is different. But these are 3 pretty standard exercises we give almost everybody because they're strengthening exercises for the core and some of the muscles in the hips. So, first exercise we're going to show you is, Todd, lay down on your stomach on the table. We're going to do, we call them Supermans or prone Supermans. It's an exercise to strengthen up the muscles that stabilize the lumbar spine and work on the hips a little bit. So, the fully progressed exercise would be, Todd's going to straighten out his arms, thumbs up towards the ceiling, and he's going to lift both his arms and legs at the same time. Okay, and he's going to hold there. I want a 5-second hold. Okay, and then he's going to relax back down. That's 1 rep. You can start with this one around 10 reps, and you can progress up to 15, 20 reps as you get better at it. Okay, now it's important that you make sure you don't have any pain with this. If you're doing this and you're feeling any pinching or sharp pain in the back, or certainly anything going down the leg, then this is not an exercise that we would want you to do. You can regress this. So if you can't do both arms and both legs at the same time, that's fine. Hey, what I want Todd to do now is he's going to go ahead and just lift one arm up off the table. Now, it might not seem like it, but as he's doing that, he's contracting what we call the multifidus muscles. They're the medial rector spinae muscles that stabilize the lumbar spine. Okay, and then go ahead and get back down, Todd. And if he wants to progress from that, then he can do both arms at the same time, and that activates a little bit more of the musculature down here. Okay, and then back down. Another way you can do it is you can do the same thing with the leg. So keeping the leg absolutely straight and then lifting up off the table. Good. And again, holding for 5 seconds, and then back down, and then progressing from here, he can lift both his legs up off the table. Good. Again, getting a lot of activation of the glutes and the muscles that stabilize the lumbar spine, and back down. Okay, let's go to the next one. Todd, get up in quadruped. We call this our quadruped TVA vacuum. So what that means is transverse abdominis, TVA. Transverse abdominis is a muscle that wraps around from the back, the thoracolumbar fascia, wraps all the way around to the front. It's kind of like the barrel to your core, so it's really important to activate this one. So I'm going to use this foam roller to make sure that Todd is in lumbopelvic neutral. So let's talk about that a little bit. Lumbopelvic neutral is where you want your spine to hang out most of the time, whether you're sitting, standing, moving. This is where you want your spine to be. And it has 3 main components, well 4. The pole has to touch in 3 spots. So it has to touch on Todd's head, his thoracic spine, somewhere in his mid-back, and then on his tailbone. And then the 4th component is the space in between the pole and his low back. When they're touching these 3 spots, has to be the width of his hand. So Todd's got to kind of drop his back down a little bit. Yeah, and you can kind of test this out. It's good to have someone to help you out. If someone's there, they can kind of monitor it for you, but you don't need to. If you can get your hand back there, and that's about the width of his hand is the space between the pole and his back, then he knows that's lumbopelvic neutral. That's where you want to hang out most of the day, so obviously we want to train in this position. So all he's going to do, really simply, is maintain this position. Nothing is moving in his back. Todd is going to draw his belly button up towards his spine. Okay? So this isn't like you suck in your stomach like you're taking the family picture. This is gently drawing the belly button up and feeling the contraction of the transverse abdominis. And you should feel some contraction, some muscles working in your abdomen. When he brings it up, he's going to hold it for, we can breathe in and out 5 times. So it's going to be somewhere around 10, 12, 15 seconds. So breathe in and out 5 times. Relax. When Todd relaxes, his belly button drops back down towards the table, and he starts over. Okay, then we're going to do 10 reps of that one. Okay. All right. And Todd, last we're going to do is a bridge. So Todd, lay right over onto your back. Okay, and a bridge is simply Todd's going to get onto his back, bend his knees, toes are pointed straight ahead, and all he's going to do is push down with his feet and lift his hips up off the table. Before he does that, he's going to contract his glutes, which just means to kind of squeeze your cheeks together to get those muscles activated first, and then push down with his feet and lift his hips up off the table. Okay? Now he has to do this through a pain-free range of motion, meaning if Todd gets up here and he says, oh, my back is bothering me, or I got like a little pinch in there, or certainly anything going down the leg, then he can't go that high. You never want to push into pain with this exercise. Okay? And then go ahead and lower back down. So holds with this one, we want to do a 5-second hold. Again, you can do 10 to start out, and then progress up to 15 to 20 as you get better with the exercise. If you go through the range of motion and it's sore at the top, or you're having any pain, just decrease the amount of range of motion that you go through. So let's say Todd had some pain at the top. He's just going to kind of squeeze here, lift his hips up off the table, and only go through a shorter range of motion. If he goes any higher, then he's going to have pain. Then just go through that range of motion. All right. So those are 3 really great exercises for general low back health. Okay, again, not super specific. If you're doing these exercises and they're working out for you, great. That's the idea and the concept of these videos. If it's not, then we would suggest you go and get an evaluation from a physical therapist. So if you're in the Lehigh Valley, you can come to Robbins Rehabilitation to be seen by any of our therapists. Call our number, 610-841-3555. Set up an initial evaluation where we go through a complete evaluation of what's going on with your movement, really. I mean, physical therapists are movement experts, right, Todd?
Yeah, I mean, what I always like to tell my patients is that the sooner you can get someone to really take a look at your back problem, the better. I often have patients that have come in and they've had it for 4 months, 6 months, a year. I always say, I wish I could see you right when you started out. So yes, physical therapists are movement experts. You can come into any of our offices without a prescription. You can just make an appointment to get a complete evaluation and really get an assessment of what's going on specifically for your low back issue.
All right, great. We hope this video helped you. We hope the exercises help you too, and we'll see you next time.